So welcome everyone to session number 2. We want to thank all of y'all for being here. I know it's Saturday, it's a holiday, it's 10 a.m., which is super early for a Saturday, but you all are here and we really appreciate that. So today we are going to talk about the secrets of parenting. Again, this is a 60-minute Zoom session, so essentially we're going to be here talking and discussing for 60 minutes. So let's do some presenter introductions. So today we have Dr. Shengtian Wu. Dr. Shengtian Wu, right now he is an assistant professor in school psychology at the Illinois State University. He earned his doctorate in school psychology from Mississippi State University, which is where I too earned my doctorate. His research interests really looks at school consultation, academic and behavioral interventions. Dr. Wu has a lot of experience working in the schools and also in the clinical settings with children and adolescents with and without disabilities. And next we have Pamela Cornjeo. Pamela is a doctoral candidate in the school psychology program. In the counseling psychology program. So we have a counseling representative today, which this is the first time that we're having one on the session. So Pamela is a graduate student here at the University of Utah, where I too am. And her focus is on cultural sensitivity in youth and family intervention. Pamela has worked with families for the last 10 years, providing evidence-based treatment for children with concerns of trauma, behavioral concerns, mood disorders, and developmental delays. Her research focuses on examining the efficacy of treatment for Spanish-speaking adolescents and caregivers. Okay, and of course, for those of you who attended last week, you all already know me, but for those who are joining today, I am a postdoctoral fellow in the Department of Educational Psychology at the University of Utah. My background is also in school psychology, and I present experience working with children on assessments and interventions in academic and behavioral settings, kind of helping children with and without disabilities kind of navigate through those challenges. Okay, so with that, so today we're going to talk about the secrets of parenting, and essentially through this session, we are going to really talk about or provide you with a more deeper understanding on why it's so important to train parents. Children don't come with handbooks, and parenting is something that no one teaches you how to do it. And that just like that experience can be a roller coaster. Sometimes you have ups and downs, and ups are great, right? We all want to experience that. But what happens when you have those kind of lows? It's really difficult. It can be emotionally exhausting. And that can get in the way of how you parent and how you become a successful parent. So we are kind of going to touch on giving you a deeper understanding on that. We'll talk about common challenges that parents experience in the Sri Lankan culture. We'll talk about some skills that will hopefully teach you better tips and tricks and strategies around parenting. We will also talk about play. Play is such an important thing. Children love to play. And how can we use play to teach children and kind of really tactfully doing that. And last week I spoke about the power of offering choices. And today we will kind of elaborate on how you can, we can pass over the power of choices to you all. Okay, so this is a video. This was a question that we got from last week's session. Given the pandemic, you know, our kids are experiencing more and more screen time, and sometimes like parents are overwhelmed, and the easiest thing is to give your kid a device, the phone and iPad, and just like let them engage with it, right? So that you can have peace and quiet for 10-20 minutes, and that's okay. We all just need kind of that breather, but sometimes it can get a little out of hand, where children start becoming almost addicted to screens. So this video really talks about how we can, kind of manage those. So it's a 30-second video. Let's probably just less than a minute, but let's quickly watch that. Let me share my. Let's see.
Does your child spend too much time on devices outside of remote learning time? The American Pediatrics Association recommends a daily maximum of 2 hours of screen time. To accept the answer no when they ask for screen time. First, you will need to teach your child an appropriate way to ask for screen time. Teach your child to say, "Can I have screen time?" Practice by giving access to screen time when your child asks appropriately. Praise your child's behavior when they ask appropriately. In our next video, you will learn how to teach your child to accept the answer no when they ask for screen time.
All right, that was like a really quick video, but last week we spoke about the BURST project. So essentially, the University of Utah, the UT Tech Lab, essentially, together with the Granite School District, get together and make this like really brief video clips to really help parents, teachers, and students be successful, especially at a time like this. So if you are interested, you can go ahead and scan that QR code if you are interested in learning more about these videos. Okay. So here's an activity that we are going to do today. So if you have your phone, or if you are on a computer, I want you to go ahead and open a new tab and type www.menti.com. So this is like a little activity. Let me know if you are having difficulties accessing. So essentially, sorry, www.menti.com, and once you go to that screen, you should see something like this. And there they should ask you for a code. And the code that you will enter would be this number right there. I'm going to stop sharing my screen for a bit. Let me know if anyone's having any trouble logging onto this. Good, I see one person logged in. Can you all see Shengtian and Pamela? Can you see my Menti screen? Okay. So you would go to www.menti.com right here, and they will ask you for a code. You will put in that code here. And then once you get on, I want you to answer this question. What is something you appreciate about your child? If you don't have a child, that's okay. If you are an educator, if you are a therapist, think about the children you work with. And what is something that you appreciate about these children you work with? So some of them are enthusiasts, some of them are loving, some of them have good manners, some of them listen, they're hardworking. I absolutely agree. Our kids are really great. helpful, creative, good behavior and love, absolutely. Creative, enthusiastic, helpful. These are really good responses. Completing tasks properly, so complying with what the adults want them to do. They don't keep grudges. Yeah, they're so innocent, right? They take interest. Yeah, they are like these sponges. Like they're so curious individuals, and that's the time that you can give so much stimulation. They're very pleasant, tiny humans, right? Okay. So it seems like a lot of people here think that kids are creative, then they are helpful, and then they are loving. So it seems like these are like the three main kind of themes among all of y'all. Awesome. Thank you for participating. You can keep entering. It's just going to load onto this, and we can revisit this if there's something major that changes. So thank you for participating. Okay, I am going to stop sharing. All right, so with that, I just wanted to kind of have that little activity just to see what you're experiencing. Working with children, being at home with children, teaching children, it can be very stressful. We do definitely empathize with that. They are pleasant, they are loving, but also they can drain us. They can take away all of our energy. But like I said, there are positives to it for sure. But so with that, I am going to hand over the webinar to Dr. Wu, so he can kind of begin his session. Okay, you do have sharing rights, so all good.
All right, can you guys hear me well?
Yep.
Awesome. All right, everybody. As Chet introduced, my name is Shengtian Wu. I'm currently a assistant professor at Illinois State University, and I feel very, very honored to be invited to this talk and able to communicate with you guys in terms of parents training, especially strategies and challenges. One of my interests is learning culture and language as well. So before coming to this session, I was, Google and go to YouTube and then look for some Sri Lankan language, both Tamil and Sinhala. So I'm gonna say it. I don't know if it's correct or not. I was just copying YouTube and Google, so it could be wrong, but I'm gonna try my best. Tamil, just gonna say, Tankurukumikanandri. I'm not sure if it's good. I tried my best.
Nice try, Shengtian. Let's hear the Sinhala one.
All right, I'm gonna try Sinhala, which is Buhumastuti. Okay, tried my best. I believe it means thank you so much. So I just want to say thank you so much for coming to the talk and interacting with us. Thank you so much. Thank you. I see Sandali and Purnima were saying beautiful, was great. Thank you so much. All right, I'm gonna start my talk. So I know the time is limited in terms of the talk, so I can't solidly deliver everything, but my goal is to help the audiences to understand better about what is parent training and talk about an evidence-based intervention called shaping. And the other one is talking about the challenges when it comes to parenting and parent training. Ultimately, I really want all of us, not only continuously pay attention to parent training and parenting and keep learning, because that's how we learn about certain skills, right? It's about continuous effort and learning. So parent training. So basically, intentional actions to learn and practice about parenting strategies. But why that is so important, right? In my perspective, it's really important because you can make a parent become an expert. First of all, I want to know how many of you guys are actually parents. If you're a parent, please raise your hand using the Zoom button.
Or you can also put it in the chat and I can monitor that for you.
So you can say, I'm a parent, or yes in the chat box, or you can thumbs up using your Zoom functions, if that works pretty well.
So we do have one person. We do have another. So far we have around 3.
Gotcha. Just checking how many of you guys are parents, how many are therapists or like future therapists. But most of the time, parents, when they have concerns about the child, they probably go to a therapy sessions for like 1 or twice per week, which may last to 1 or 2 hours. I mean, at the same time, you probably have to spend money for, therapy sessions. So it's kind of a lot, but by doing a great parent training for the parents who need those supports, they can become an expert where they can provide support at home, eventually for free, and not only 1 or 2 hours per week, they probably can provide as many supports as possible, And what research indicated about parent training is that the support not only helps, the improvement are actually lasting quite a long time compared to just go to clinic and receive the services. And parent training were successfully helping out in terms of teaching communication and language skills, improved cognitive abilities, prosocial behaviors, adaptive functioning, and academic skills. And not only have the children implement the skills with one individual, it helped them to using those skills with a variety of the people and at the same time in different settings. Also, for the parents who have children may present some challenging behaviors, they often experience feelings like isolation. They also experience high level of stress and some other psychological difficulties. But having the parent training can empower them. Having those great skills eventually decrease their stress and have them become more confident as a parent, and at the same time, remediate some of the mental health concerns as well. And in terms of parenting programs, there are a lot of different type of programs published in the research. The degrees of evidence supporting the effectiveness are varied depending on different programs. But based on California evidence-based clearinghouse for child welfare, there are 4 programs are highly effective or highly supported by research evidence. The first one is parent-child interaction therapy. Parent management. The second one is parent management training, and there's the Incredible Years and positive parenting programs. These are all excellent programs, and I would really love to cover one by one. However, the time is limited. But there's a common factor out of that 4 programs. So let's give a guess. And these pictures are a hint of the common feature of the programs. What would that be? You can type in the chat box or you can speak up. Just based on your guess, would it be that common factor that exists in every effective parenting programs? What would that be?
feel free to use the chat, or if you want to unmute and respond, that is okay too.
Absolutely.
So Shengtian, essentially the question was, what is kind of the common theme or the similarity across these 4 pictures?
Mm-hmm. And the pictures are the hints. And I would say that's like examples.
Okay. So we do have some responses on the chat. Making use of things available at home, being present with children, interactions, closer interactions, spending time at home, engagement, happiness.
I think that all counts. That's all counts based on the comments, right? It's all positive and it's all preferred by the child. Child seems to be happy. Absolutely. Mm-hmm. Mm-hmm. Get loving, connected, put yourself in their shoes. Absolutely. Doing things that makes them happy. I think that the last one is very close to the answer that I bring, although everything is actually really, really good answers. Absolutely. So the common features of all the programs are actually called positive reinforcement. In other words, in our like human language, called the reward. And I just bring some of the common rewards, especially in this U.S. culture, USA. The first one, high five. We love high five. I love high five. When child engage in good behaviors, give them high five. It's free. I give them. Some of the folks like food. I think that this is Sri Lankan food. I googled it. I don't know if it's correct, but
it's a Sri Lankan hopper.
Right. Guys, it's 11 o'clock p.m. in this area, and I'm pretty hungry now, which is not good. The other things that American countries or American schools utilize quite often is the token system. If you can see this one, it's like a fake money, but the school system utilize that to reward students. So by earning those fake money, eventually they can use that to buy some like food, activities, or other things that they would like. This is the funniest things that I would say that I observed out of the school. In one school, the highest level of reward in the school is that you gain all the tokens, spend that, and buy a pie, and throw that into principal's face as the highest reward. And I thought that's really funny because I know that's never happening in my country, China, or my culture related to Korea. It's not happening, but it's one of the reward. I think it's so funny. So positive reinforcement is the common feature at the end of the day, which means you do something so that one behavior happens again because that's so preferable, that's lovable. It's a positive reinforcement. Not in Sri Lanka as well. Nope. All right. There's another feature. No way. Yeah. Another feature is that all of the programs missing one thing. What would that be? And again, this picture is the hints or the examples of that thing. So if you love to type it, that works just like what you guys are doing right now, or you can speak up if you want. As long as you don't, yep. Punishment. Punishing, yep. The other common feature is no corporal, verbal, or emotional punishment in those programs. Thank you so much for all of your questions. And it's so sad, but this is one of the things that I observed in southern part of USA, Mississippi State. This is something that I experienced by myself with my mom. I did something wrong. My mom, say like, you shouldn't do that. This is something that I observed out of Korean culture. When I was younger, I'm Korean and Chinese mixed culture guy, I would say. But when I was young, when we made mistakes, and teachers probably like you that you put your hands like this, and they probably hit you like that. I don't know if it's existing anymore, but that was what's happening previously. And again, going back to our own topic, all of the programs does not have this punishment system or components. Briefly talking about the importance of not punishing people, speaking of the effects, right? The first one is effective punishment. The first effect would be it would lead to some escape or avoidance-based behaviors. Reasonably, if the child knows if I make some mistakes, I probably get punished, then they potentially do something like lying, not attending, not speaking in order to avoid the punishment because it is scary, right? The other thing, the second part I think is kind of scary is that people who punish the students or the child may unintentionally get rewarded because we may think, all right, I punished this child and this behavior is disappeared. And the next time I will do the same punishment, but it's not working this time. Then what would be the possible route to go for the people who is punishing? Likely, the intensity of the punishment can increase, right? Which is not a good sign, actually. When the intensity increases, what could happen is that it could lead to more physical harm and other harms as well, psychological, emotional harms as well. Right? Third one, again, it happens sometimes unintentionally that by punishing certain individuals, like children, they would unintentionally learn about the aggression because now in their mind, they're thinking, I'm get punished because I did something wrong. If it's reasonable in their mind, they probably do the same thing for their own children or other people too, because they have learned through the experiences that when people get wrong, they can get punished, like how I experienced. So that's really, really unfortunate, negative outcome of this punishment. Or the people who punish sometimes, or quite a lot of times, they really care about this child, but this methodology itself have really like negative outcomes, unfortunately. And based on the research, 99 of the research studies find that the punishment actually result into negative outcomes. We know a lot of studies are conducted in the USA, but it's not only applied to USA, that includes countries like Sri Lanka, China, Singapore, Philippines, Australia, Canada, and much more countries. And when it comes to specific negative outcomes, that includes physical harms, psychological maladjustment, impaired cognitive development, and increased aggression, antisocial behaviors, as we discussed up there, and disrupted attachment between the children and the parents, and low levels of helping behavior, empathy, and moral judgment. Now, what about our positive reinforcement or reward? There's just infinite evidence of its effectiveness. As we discussed, all the programs are largely or mainly based on how to reward people to teach them appropriate behaviors, right? I just put some pictures of there, which is all the children's or even including us get addicted about getting the likes, getting the positive attention from other people. It's so good. It feels good. All right, so I am gonna talk about one intervention that's basically based off how to reward people to teach appropriate behaviors. We call it shaping, just like the picture behind the word. It's like slowly shaping a good behaviors from the beginning slightly and gradually create an appropriate behavior, So it's a very patient, slow, gradually changing type of intervention that's supported by a lot of evidences. So I'm gonna share a quick video with you guys before describing about it. So let's see, this one. All right. Chat, would you tell me if you can hear this one when I turn it on?
Shengtian, can you enable your computer sound?
Oh, okay. My computer sound.
So essentially, it's an option on the Zoom. In your taskbar where you have the mute, the camera, that little taskbar. If you click the three dots to the right, you should get a drop down. that says enable computer sound?
Enable computer sound.
Or just
Oh,
computer
sure,
sound?
computer sound.
Yeah, yeah.
Okay. All right, all right.
Okay.
Oh, no.
Can you hear this?
Go ahead and play.
Not this one.
Can you hear the sound?
This is the grand finale of it. Yeah, that's the last one.
Can you increase the volume a little bit
Okay.
on either end, or on this, or on this YouTube clip essentially?
Yeah.
There you go.
No. Okay.
Can you hear the sound?
All right. Huh? Oh, no. Not this one. This is the grand finale of it. Yeah, that's the last one. That's what I was wondering. I don't know what they're gonna do next season because they did some stuff this time. Exactly what I was thinking. Oh yeah, yeah, yeah. Right. Don't bring that again. You know what I'm saying? Don't do the same stuff. You know what I'm saying? Yeah, I was thinking that. Yeah. Yeah. Like go somewhere else with that, but don't bring it here. You know what I'm saying? Yeah. That's what I said. And then it was like, you know what I'm saying? And I was like, what in the world? But don't do that here. You know what I'm saying? Yeah. 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 Really? I thought the same thing. We think a lot alike, huh? Oh, that's crazy. Right.
So, let me see. Were you guys able to hear that?
Yep.
That's awesome. All right, all right. So that video, it's a very fun video. But in the video, in that cute video, what this father is doing is that responding to the child, right? Even though the child is actually just babbling, it's very incomprehensible, but it's responding. So unintentionally, this parent is actually engaging in shipping. So what they do, the child is really wanting to imitating the parents and want to be able to communicating just like what his father or other people does, and he was doing it. And the father is responding to the child to make the child happy and still speaking a adult language so that the child can hear and gradually learn it. More specific examples in our life would be, let's say, a mom sees a child babbling and we love it. We let them babble more. And we're like, yeah. What do you say? And eventually the child is able to say ma. And we're like, oh gosh, did you hear that? He or she just say ma. And we're more excited, right? And we just keep encouraging the child to say ma and mama. And eventually the child say mama. And we're so happy and give a lot of praise for the child saying mama. And once the child is totally cool, totally able to say mama, then we're not really giving praise for babble and only give praise for mama or higher level of the words. So unintentionally, we're even implementing this innovation called shaping, gradually helping the child speaking a more complex, harder words. So that's shaping. And let's talk more about what shaping actually looks like in terms of specific steps. So when we use the shaping to teach certain behaviors, first step would be define what behaviors we want to teach. So in the research, what people does is, let's say we want to teach a child who has language disability, who can barely say a sentence, we want to teach them to speak multi, words sentence. So let's say we want to teach a child to say, I want iPad, please. I want iPad, please. And that's too hard for them. But let's say that's our target word, which hasn't been appeared for the child's in previously. It's a new words for them. And the second step is decide if the shaping is appropriate or not. Okay. For sometimes if it's easy skills to learn, we can just teach them. We don't have to shape it, right? We just need to make sure that behavior hasn't happened and it's tough enough, hard enough to utilize shaping as in our interventions. So that's our second step. The third one is to choose a behavior out of the child, which is close or one step before going to our eventual behaviors. So let's say in this specific example, the child is able to say iPad, but the child is not able to say, can I have iPad, please? Then we can start from the first approximation, the first step, which is iPad. And we reward the child with the first step, which is iPad. Then we gradually adding the word from iPad to reward iPad, please. Then gradually we reward, can I have iPad, please? So in that way, we didn't have to push the child very hard, and we gradually enhancing the child's behavior from small piece, larger, and more complex piece, And throughout the procedurals, all we need to do is reinforce it. We reward them when the child presenting that appropriate behaviors. So we really need to know what our child really likes in terms of their rewards. Some childs like pizza, some childs may like iPad, some childs may like something else, but knowing what they like is really, really important in terms of shaping interventions. And as I said, from reinforcing the first behaviors to gradually reinforcing or rewarding harder and harder behaviors as the child gets better, but not reinforcing or rewarding the previous easier behaviors as they master harder behaviors. And the key aspect of this intervention is that we gotta be proper, right? We're not gonna rush them. The cool part of this intervention is slowly, moving them to a more complex, aspect instead of pushing them too hard. So that's this intervention. We call that the benefits of this intervention. We call that has high response efficiency. That being said, we decrease how hard it is for them to engage in certain behaviors. So instead of having them engaging in hard behaviors, we start small and gradually increasing. And the other important part is that we always giving some reinforcement, reward. So in child's perspective, they're like, I'm not doing some very, very hard behaviors, but I'm still getting some reinforcement, reward from these people. So in their perspective, they like you because you are the person who give a lot of rewards, So that intervention also helps building good relationship between you and your child, So that's another strength of this intervention. And ton of research space for these interventions. They have utilized shaping to teach athletic performance, communication skills, toilet training in infants, academic engagement, compliance in medical interventions, cocaine abstinence, and actually more, Scenario. Scenario may take 1 or 2 minutes, but Chad, do you think we have time for scenario? 2 more minutes.
Yeah, we have around, I want to say, around 20 minutes left, and if you can pick a good ending point, that will work.
Yeah, scenario, let's pretty much skip it then. I have a challenge that I want to cover. So let's go for the challenges. So the other important thing is that intervention is not everything when it comes to parenting, because even though we have the skills, there are other barriers that potentially, impacting the parenting procedures. And what literature says about the challenge, the first one is other family process can impact our parenting process. The first one that they mention is marital conflict. Then peaks at work-life balance. That's one of the things they mentioned in the later slides. Definitely work-life balance matters when it comes to parenting. The first one is marital conflicts. That being said, you and your partner has significant conflicts, then that definitely impacts how you're actually interacting with your child. And parental mental health is another bigger concern. Just imagine if a parents are super depressed or super anxious about something, then that could also impact how they interact with the children as well. Sanka also mentioned about the work-life balance, if a parent has extremely hard work, then the stress level will be increasing. That could also impacting our parenting skills. So as a parent and as a therapist, we need to be mindful about those factors which are impacting our practices. The suggestions for these conflicts or these challenges is that choose what kind of services we need. For not severe type of challenges, we can just keep receiving the training, parents training, like what you would do in the normal situations. But for somewhat severe situations, you may work with your therapist to handle that, less severe family issues. But when it comes to very severe, family situations, you can actually work with another therapist if it's available to handle family issues specifically, while you meet your another therapist to work on the parents training parts. But let's say if the mental health or marital conflict part is too severe, then what research suggests is that you pause parents training first and then work on the mental health or marital parts first. Let's go a little faster since we are out of time. But the other things that I mentioned is that some of the families may have multiple children, very hard job, or the parents may work very, very long time, which can be impacting their parenting efficacy. In that way, people are mentioning, for the people who doesn't have a lot of child, doesn't have a demanding job, doesn't have a long work time, for those population, they can use self-help resources like books, other resources to help them. But when it's getting a little bit intensive, they can attend in groups, not too intensive, but small groups or large groups to getting some help for their parenting strategies. But for more severe situations, they need to look for more individual meeting with therapists. And when they have very, very severe family issues and other issues going on with the parenting concerns, then they probably have to look for multiple meetings or programs to help their parenting concerns and other issues too. And the other thing that we need to be mindful is that a lot of interventions are coming out of Caucasian backgrounds, which probably not able to be applied directly to other cultures. In that case, parents need to be mindful about, is this program meeting my needs? And the therapists also need to be mindful that, is what I'm delivering actually acceptable to the parents or not? And they can focus on changing the contents and process to meet the parents' needs. We got three more specific concerns. So due to we don't have enough time, I will just skip through that, and
we can always revisit that once Pamela gets through, and if there are any questions that the audience has.
Sounds good. Just one more. Yep. So that's it. So I will pause my sharing and have Pamela continue talking.
Sorry, thank you for that, Shengtian. So Pamela is going to touch on more kind of the play skills and really provide you skills on how you can kind of transition that and apply those to your kids and individuals you work with. Over to you, Pamela. Thank you.
Okay, we're going to go through this very quickly because I do want to leave room for those questions. So we're going over supporting positive relationships, and specifically I'm going to go over it within how we communicate with children, how we provide choices, and how we engage with play. So first, in terms of communication broadly, we can think of it as one way that we communicate is verbally. So the things that we say, and that is extremely informed and shaped by our culture. And so please, in the chat, mention some of the ways that the culture in Sri Lanka decides or shapes how you think communication should be with children. And one of the examples that I'm thinking about is that it's very family-based. So even though we have the larger, broader culture. Within my family, there are specific things, and within your families, there are specific things, right? That also let us know what is an appropriate way to communicate between people. So in my family, we're very loud. We're coming from a Mexican background, and even when we're happy, we're loud. When we're angry, we're extra loud, and that's okay, right? But that might be different for everyone else. And so please in the chat mention all the ways that your verbal communication has been shaped by culture. And also lets us know what's appropriate or inappropriate. And even though I'm an adult, I could never interrupt my parents. That is extremely inappropriate, right? So that's just something that's really shaping the way we interact with children and teach them how to appropriately communicate with us. Another thing that's important to keep in mind is that it should match your child's developmental levels. So if we have some speech concerns or some sort of cognitive delay, as Shengtian mentioned, we have to simplify the way we communicate with them. And that's just fair. It would be awful if we spoke or presented all of this information in really intensive vocabulary that you're not familiar with or don't really want to learn. So we try to make this as engaging as possible. And that's the same with children. Another way that we communicate is non-verbally. So through our bodies or through our faces. My family loves to point with their lips. And that was so hard when they'd be like, go get me that over there. And I'd be like, what am I getting? And they're like, well, that thing over there, right? And please name, what are some nonverbals that you kind of use with children or in your family? And again, it's culturally shaped. We know in the US that people like to do thumbs up, and in other cultures, it's a big no-no. It means something totally different. So if you can think of some gestures that are very common in Sri Lanka, as Shengtian mentioned, we're learners and we love to hear these pieces, and I love culture, so I want to hear more. And again, that brings us to a piece, it's learned. So they're going to vary greatly and they have to be taught. Children don't know those customs right away, but over time they pick up. Just like I learned, like, okay, if they're saying something, my parents tell me to get something, I got to see their faces because they're going to use their lips. I just want to see real quick in the chat. Oh, I see there's a lot of really great examples, and thank you so much when naming those, and keep doing that because I would love for you to do it. Okay, so communication is important because when we do it well, our children feel heard and we feel heard too. And it encourages them to learn different ideas about how the world works. It provides them with tools that are absolutely necessary as they develop and grow up. It helps us feel overall very connected. And when it doesn't go right, we tend to feel really upset in different ways. And we still experience that as adults, right? Or it might also make us feel confused because there's something that we're not understanding here. So in terms of making effective directions happen with children, our advice would be to make sure that it is brief, not too long, don't give a story, and be very specific or clear about what you're expecting, and then give them a moment to respond. Sometimes we want children to do something immediately, but their processing of this information or your direction might take a second. So it's important to let them have a moment to think through that. So here's an example. It's dinner time, and you might be saying, dinner is ready, hurry, go wash your hands for dinner. Tell your sister to wash her hands too. What do we think about that? What might be a problem with that? And you can just jump in the chat. And here's what I think. It's a little long, and it sounds like if you're shouting it, you're probably not very close, and that's not too helpful. So a different way we could say that is to get closer to that child, shorten it down, and name, like, okay, go wash your hands for dinner and let's eat. So that's an example of how we might normally talk with an adult and kind of shorten that for children. One thing I wanted to touch on is the power struggle. So in times when we give an instruction and our children say, no, I don't want to yet. This is something really common that's frustrating for everyone, right? You might be on a timeline, you might be trying to get things going. Oh, I appreciate you saying that it sounds dominating. I think you bring up a really wonderful point. These suggestions are always adaptable in the ways that it makes sense or feels like a fit for you. It's always relationship-based and family-based. So I really appreciate you naming that. And I think it's important to think about how do these suggestions or some of those examples fit better for me? Because that would be the more important piece, is how does it work for you and your family? So I also wanted to, so please bring those up as they come up. So that's some of the pieces that I'm thinking through when it comes to power struggles. They're typical, they're not uncommon, you're not alone if you experience them. And what may be counted as a power struggle varies based off of our culture. So it might be within my own family, if I take too long to do something that's requested, that's not acceptable. We are supposed to respond a little more quickly. And so maybe you can think of ways in which you define those moments of conflict or a power struggle. So some of the ways that we can address the power struggle is to provide appropriate choices. So one way to do that is provide a menu. So in the previous example, we might say, okay, it's time to do chores. Which chore will you start with? So we're letting them know that not doing chores isn't an option. We are going to do chores, but we're going to decide from these menus of options. So you could either finish your homework, clean your room, or clean up dinner, for example, or help wash the dishes. And so we're providing those options. So here's another example. So you might have shared with your child, you've played video games for an hour. Now it's time to do something else. So what might be some appropriate menu options for children if you're trying to get them away or to finish with a different activity? What do you think would be another way, some other options to give? Finish your homework. That's a great one. Play outside. Awesome. So maybe you're thinking it's okay if they continue to play. I just don't want them to do video games. So offering to play outside is a really good idea to transition away. Some other sort of activity. Those are all great examples. Another option to give choices, another way to phrase it, is to use the if then phrase. So we say, if you do this thing, then you get access to do something else. So you might name, if you finish your chores, then you can play video games again. That might be the weekend and that's okay. And so that's another way to kind of phrase and shift their attention to something else, but still communicates that you have an expectation. So in this example, if your chores are not done, then you could also name what a consequence would be. It doesn't mean punishment necessarily, but you might say if your chores are not done, then you don't get to play video games again later today. Or then we won't leave on time to go somewhere or something like that. It's helpful to name what a consequence might be when we don't do something, because that's actually just a part of our development too. Yeah, that's a great idea, Chad, to say like, okay, well, no candy or no dessert. Another suggestion I would offer is to keep it simple. So maybe for some children, offering a menu is too much, or maybe they're not quite sure what if and then mean. So we might simplify this even more. So your child might say, I'm really thirsty, can I have soda? And you might respond, soda's not an option. Do you want water or tea? And that's another way they know they can access soda, but they can still make some sort of appropriate choice. Are there any questions about those pieces? Okay, great. Play is something extremely important within childhood. It's part of the building blocks for learning. So it helps us in terms of how we create friendships and understand our family. It also helps us to regulate emotion. It's a way to de-stress. And even as adults, there are ways for us to play that's enjoyable and appropriate. And it also helps us physically. So certain games allow us to build our muscles and develop our fine motor skills when we're writing academically. And also helps us with cognition, because we do a lot of learning, right? When we're taking our blocks and matching colors or using dough and creating things. So it's extremely important. So some of our challenges or concerns related to play are tied to what people have already named, which is that we might not have the resources to play. We might feel that we need certain things, or we might not have the time to play. And I can definitely understand with those pieces feeling like I really need to get dinner ready, or I have to focus on the house chores. You might not have energy. Some other pieces that come up is that there might be culturally expectations on who gets to play. I noticed within my own culture that dads are not necessarily the ones to play. They're the ones to offer discipline. And so I'm curious to hear from you all, what might be some other reasons that play is a little challenging? Thank you for your question. The questions, do you think having too many toys will impact development? And that's a great question. And I think it really depends on the child, right? So some might say too many toys will make them spoiled and not appreciative. Or someone else might say too many toys means it's a lot of work to clean up. And so I think the best way to think through that is, who is your child? What do you know about this person and their personality and the way that they learn? If you think that there are better ways to navigate how many toys or how they access them, I highly encourage you to do what you think would be helpful. So I wanted to name that play can be simple. It doesn't have to be expensive or anything fancy. I love when someone named like send them outside. Absolutely, that's a great place to play and to get out some energy. And to use what's readily available and be creative. When I have worked with children with autism, sometimes they would get too distracted by toys. So we used the simplest things that we could, like pillows and blankets. So use what's naturally in your environment. It can also be functional, so incorporate it in your daily routine. So maybe through songs and bath time or organizing your items. So I would name it as let's put all the things that are blue away. And we would try to find all of those moments and try to make it fun, even though it's a chore that we're doing. And again, making it instructional. So having it be another learning opportunity. So some problem solving like puzzles, or imaginative like pretend. Another piece that I think is really important with play is to build patience, for them to wait for their turn or to be okay with losing. Even though it's kind of hard. I still struggle with losing, but those are some of those areas that play can be as structured or unstructured as you want it to be. One of the questions was, how do we read their personality? I do think children show personality very early on, but Chat and Shengtian, please jump in at any points. I think you'll start to notice patterns in their behavior. Like some children don't like to share their snacks, right? And they're very food motivated. So all of those little behaviors start to be signs of bigger personality, and you just have to kind of notice. With children, it may not come through verbally very obviously, but it should come through behaviorally. Oh, that's a great example of your daughter helping in the kitchen. That's wonderful. My mom would never let me touch the kitchen until I got a certain age. She thought I would ruin the recipe. And that's okay. That's all right. She taught me eventually. I wanted to name this book. And I wanted to leave a little bit of time to chat. But this book, An Early Start for Your Child with Autism, it does focus on children with autism. However, I highly do recommend it if you're interested in using play to teach, because there's some skills in there that are very simple, easy to follow, that would be helpful regardless of whether your child has autism or not. Feel free to check it out and see what you think, or you could email us or email me with any questions you may have. So I'm going to pause the share. I know I went through that very quickly, but I wanted to open up for your questions and your reflections and thoughts.
Thank you so much, Pamela and Shengtian. And I know we went a little bit over time, just 7 minutes, but I think we can use this time to answer any questions. So a lot of you kind of did present your questions as the webinar was going on, and You know, some of us or all of us were kind of answering those questions in the chat, but we just want to take the next 2 to 3 minutes to see if anyone has any questions. Of course, Pamela and Shengtian, if you do want to drop your emails on the chat for folks to contact you, feel free to, no pressure, but I'm going to drop my email. So if anyone has questions, I can always direct them to either of these speakers.
I remember there was 2 questions coming up when I look at the survey. One individual asked about, gaming. My child playing too much games. What should I do? There was another individual asked about Down syndrome, concern. So if you are still concerned about that question, I would love to answer that. But if you have other questions, that'd be also great too.
Pamela, we do have a question about the book, if you want to take a stab at that.
Oh, the question, do you think creating books culture is important against screen time? I think making sure that your children try different types of play and activities is important. Sometimes we like things only because we're familiar with them. And we get good at things that we interact with a lot. And so I think allowing and encouraging time for reading would be very helpful to just at least broaden their interest so that it's not too focused on any one thing. The earlier you started, the more helpful, or the seed is planted. So if you read a book with them, and then helping them pick something, that should be helpful.
Yeah, I think that's super helpful. Also, adding to that, we want to be able. So the American Association for Pediatrics recommends 2 hours of screen time a day. And you can provide these 2 hours staggered across the day. And I think right now, given the pandemic, everyone is on lockdown. It's it's easier for parents, and it's just because there's a lot going on, and sometimes it's not great, but sometimes we just have to do things that we have to do to get through the day. But at the same time, so you can essentially use this 2 hours screen time and give it in pieces of 15 minutes. So for example, this question about reading, creating books culture, and I'm guessing this would be like encouraging children to read. So you can essentially offer, let's read for 15 minutes, and then you'll get 10 minutes screen time. And then later you can eventually increase that. Now let's read for 20 minutes, and I'll give you 10 minutes screen time. So that way we aren't just directly exposing children to continuous, strenuous hours of screen time, but we're also kind of including other activities as the day progresses. The next one, how do we communicate or punish a child who lies a lot? A child who has autism, to teach her it's not a good thing. Can you elaborate what you meant by punish? And feel free to use the chat function. And Shengtian and Pamela, if you want to respond meanwhile, feel free to.
For lying, you know what? Lying is interesting behavior, because for the people who lies, they have some good cognitive ability to think about, I need to hide this one from these people because I know what's coming if I don't lie. So just be mindful that that's a strength out of that student or the child. And the second thing is, please notice or communicate with the child why the child might lie. What is the reason? Are they trying to getting attention, or just like a common situation, are they trying to get away from a situation? And try to let the child know you don't have to do it. There's an appropriate way to get what you want to get. So replace the lying behaviors to appropriate behaviors, and still have them obtain what they want to get. So that would be my general suggestions. But if you give more details, that we can discuss more about what we can do.
Yeah, I totally agree. Our children are very smart. If they know how to lie, they know it's, I mean, kind of thinking about these different aspects to make a lie and to make sure they don't get caught, or maybe they will get caught. That is a super potent skill that children learn. And I know that's essentially not an appropriate behavior, but like Shengtian said, and kind of what we touched last week, why identifying why your child is lying is going to be important. Maybe your child is lying is because previously your child has learned saying the truth got the child into trouble or got punished. So really asking questions and talking to your children, but at the same time teach them how to do things correctly. Teach them and reward them, encourage them to keep doing the correct and the appropriate thing. And again, like we touched today, it's a behavior you need to shape. Slowly, little by little, gradually, we need to kind of eventually transform that lying into honest, essentially honesty. Um,
And Sanduni mentioned about a nephew who get frustrated about can't do certain things. I think Pamela mentioned about one strategy briefly, but I think we can use that in this situation. What we can do for the child is that discuss in advance about what's the result. So if we talk through that, that strategy, if you don't do this, you cannot get this reward or something like that, they probably get really frustrated at that moment because they would really want that reward, right? So what we can do is discuss in advance and then have them decide. And we tell them, what do you think we can do when you are not doing this? So we talk about that procedure first and get agreement and see if that's reasonable for them, about that specific consequence. In that way, it's more acceptable, already agreed upon, at the beginning. So it would have less anger. It would be more expected in child's perspective, I would say.
Yeah. So that was another question, the ideal age of a child to commence screen time. And I want to say again, according to what the American Pediatrics Association talks about, is for a child who's around 2 to 5, really limiting screen time for like an hour per weekday. And again, not directly, but in little chunks, stagger that across the week. So yeah.
Another
Um,
general,
Go
um,
ahead.
another general guideline in terms of screen time, because it's hard to find a one criteria for everybody. What I would suggest for a parents, teachers, or therapists is that to look for if this child engage in screen time too much, what is the concerning consequence in your perspective? Is it losing the eyesight, or is it losing communication time with the friends and other people, or losing interest in academics? If you don't have any concerns about anything, I don't think there will be specific concerning aspect. But if you do see by engaging in the screen time too much can impact certain things, then you start thinking about what should I do to decrease that screen time.
Also adding to that, Sandhani, your question about your nephew who gets very frustrated when the adults say, if you kind of like that, if first this and then that, she starts to behave aggressively till she gets what she wanted. Any suggestions to handle this situation? Yeah, I mean, if you can give like some background information about what kind of things your nephew has to do. So I think what I'm trying to get at is, so for example, breaking down tasks and giving smaller tasks initially is so important. When we tell kids to do things, we have to make sure that they can do that, because we want them to be successful. And it's easier for them to kind of engage in that task and earn the reward. For example, take homework. Your child gets 2 A4 sheets full of homework, right? And your child is not doing homework. So something that you can say is, if you finish all the 2 sheets, then you can have ice cream, right? Perfect. Your child is still not doing homework, right? So in a situation like that, it's going to be helpful to say, first do the first 5 problems. So it's a huge, say that you have 20 problems in that math homework, right? Let's do the first 5, and then you can have a piece of chocolate, or you can watch 10 minutes of TV. Okay, once that happens, let's come back. Now let's do the next 5 problems. So really you're giving things in small quantities so that the child can be successful, complete the task, earn the reward. So that way you build that connection. So the child learns, oh, okay, if I do this, I immediately get this reward. No problem, let me kind of do that. So really, yeah, making sure that we provide tasks. Think about you, for example. You are working and you get this huge project that you have to do, right? And maybe it's something that it's a lot of work. It's going to take a lot of energy. It's going to take a lot of time. So how motivated are you to complete that whole task or whole project versus if you get like a section of that project? So the same thing applies to kids. Make sure that whenever you tell them to do things, you give them the right amount of tasks at the right level of challenge, because we want kids to be successful, and we want them to earn rewards. Okay. So with that, I have kind of closing comments essentially. Thank you all for kind of hanging in there past our time. Okay, so all right, y'all, can you all see my correct screen? Okay, so I know this webinar happens every Saturday, but like we were talking initially, next week is Thanksgiving week for us. So essentially, that's the time everyone kind of, tries to disconnect from work, spend time with their family, spend time with their friends. COVID is going to make it different, but at least just kind of take that time off. So we are not going to have a session next Saturday. The next session that we will have is on the 5th of December. And during that session, we will talk about understanding your child's behavior. So essentially, we will dive deep into how to reward your child, and how to punish your child. Punishing doesn't mean always hitting, spanking, or yelling at your child. There are ways that we can punish without incurring damage to children. So we'll talk more a little bit about that when we come back on the 5th of December. And with that, I am going to drop on the chat the registration link for this session. So feel free to register. Of course, if you do follow me on Facebook, I'm not too sure, like I post this that's publicly approachable to everybody. You also should get emails from the Sri Lankan Psychological Association. So yeah, and you have my email address. If you need a link or if you want the flyer, feel free to email me. And with that, this kind of comes to the end of our session, and